Welcome, everybody. My name is Satohiro Akimoto, President and Chairman of Sasakawa Peace Foundation USA. I am delighted to have you all. Sasakawa Peace Foundation USA is a non-partisan 501c3 organization dedicated to the understanding of strengthening the relationship between the US and Japan, mainly in the area of security and diplomacy in the context of Asia Pacific. Before we begin the event, let me mention protocol for today's event. Today's event is on the record and is being recorded. Video and a recap will be posted on Sasakawa USA website. How to change the screen view? Manually change between speaker to gallery views. How to ask a question during Q&A? Use the raise hand under participants list. Please unmute your microphone when called upon. Today's featured speaker is Professor Keizo Takemi. He's a member of the House of Councillors, Japan's national diet. He is truly a man of multiple talents. In college, he was nationally recognized rugby football player on the championship team at the Keizo. He then became professor and researcher of geopolitics in Northeast Asia. Then he became very popular CNN newscaster before he became a politician. Today, he's one of the leading champion of public health in Japan and in the world, assuming many important roles, such as Vice Minister of Health, Labor, and Welfare, and also WHO Goodwill Ambassador for Universal Health Coverage. Professor Michael Reich is a discussant. He's Taro Takemi, Research Professor of International Health Policy at T.H. School of Public Health at Harvard. Taro Takemi is late father of Professor Keizo Takemi, who was very influential president of Japan Medical Association. Professor Reich helped establish Takemi Program in International Health and served as one-time director of the program. Reflecting the importance and the timeliness of the subject matter and also the speakers, caliber of the speaker we have many distinguished people attending this event, including two of our advisors, Ambassador Melan Vervier and Ambassador Carton. I'd like to offer a special appreciation to Professor Ezra Vogel. He kindly created an opportunity at his house for Professor Takemi and I to meet some 30 years ago, when Professor Takemi first came to the public school in early 1990s. So in a way, seed for the event today was planted by Professor Ezra Vogel some 30 years ago in Cambridge. So thank you very much. Professor Takemi will talk about 25 minutes and then followed by Professor Michael Reich. So Professor Takemi, floor is yours.
Thank you very much, Akimoto-san. And thank you very much indeed to give me the wonderful occasion to talk about the Japanese response to the COVID-19. And the distinguished guests and ladies and gentlemen, firstly, I would like to congratulate the Professor Ezra Vogel having the 19th birthday. And he is my mentor at the university, Harvard University, when I was there and when I was very young. And then today, I would like to talk about the Japan's experiences and the emergency of the pandemic. Next, please. Yes. In our human history, there are so many, the outbreak of the risky infectious diseases. The size of the deaths, you can compare this, the pictures that the pest is killed the largest size of the population. The COVID-19 become a very serious, those are the new type of the infectious diseases. And the COVID-19 give us, Japan, the first very serious the experiences of the emergency response to those the risky infectious diseases. Since we had a very serious infectious diseases such as the tuberculosis in the early 1960s. So since then, fortunate things that we did not have such sort of experiences and such a serious the outbreak of the infectious diseases. So the new experiences of ourselves under the COVID-19 give us so many huge political impact on the Japanese politics, and also those of the Japanese policy making related to our own security issues as well. Please, next please. And everybody knows that this is the infected cases per million of people. Even though the Japan's the total case of the test is relatively small, but still I can say that the size of the infected cases is very smaller than in the other countries such as the United States of America. Next, please. Next, please. And this is the total size of the deaths. Now nearly the 1,000 case of the deaths caused by the COVID-19 is now we have still very below. The next, please. We hit the first wave of the COVID-19 in the middle and late part of the April. And since then, fortunately, the size has been decreased up to the end of May. But unfortunate thing is that since the end of June, once again, the size of the infected case has been increasing at this moment. And still we cannot stop it. And we are facing the next wave of the COVID-19 at this moment. How to cope with this, the urgent matter is now become the first priority of our national policy again. Next slide, please. So through our experiences, I would like to point out the subject of the domestic viewpoints and 2 subjects of the global viewpoints. Next, please. The first is the control tower function of the cabinet secretariat. Next, please. Our cabinet established their own, the first novel, the coronavirus response headquarters in the end of January, and then received the several advices from the advisory group. And those at the first stage, the first virus came from the Wuhan in China. We could quite efficiently contain it through the cluster approach up to the middle of March. But after the middle of March, we faced the new type of the virus from the European continent through the Japanese who came back from the European continent. And then more than the 50% of the infected cases became unknown. Therefore, the original cluster approach could not make a real efficient outcome. And then the Prime Minister Abe recognized that we should publicize our state of emergency under our new act on the new type of the influenza act. But originally, the implementation has been done by the Ministry of Health and Welfare and Labor. And Ministry of Health and Labor has its own headquarters. At the first stage, the Minister of Health was in charge of the coordination among the health-related ministries as well. But after the adopted the new act of the influenza, the role of the coordination will be sent to the new minister who in charge of the new type of the coronavirus, Mr. Nishimura. And then now 2 ministers has taken a very serious the joint initiative to coordinate and decide and implement our response to the emergency of the COVID-19. Next, please. And as you can imagine, that the important the decision making come from the bureaucracy itself. After the publicized of the state of emergency, the Prime Minister decided to strengthen our own secretariat of the headquarters under the Minister Nishimura and established a new office for the new coronavirus, which has the 70 staffs. Most of them come from the health-related ministry, as now has the most efficient the coordinating power within a cabinet. Next, please. And then I want to emphasize that unfortunate thing that we don't have the Center for Disease Control, just like you have. Therefore, now we are thinking how to create functions for clinical and pathological analysis and testing and epidemiological surveys and the international cooperation. Next, please. Now, at the present, the Ministry of the Health and the Minister of the new coronavirus, who has the power to make highest order. And the implementation process, for example, the PCR test has been done through the National Institute of the Infectious Diseases. And the National Institute of Infectious Diseases, which has only 10% of the budget size of the US CDC, has its own branch in each prefecture, the Public Health Institute. And then this Public Health Institute has the capacity to test of the PCR ordered by the Public Health Center at the community level. And the process of the National Institute of Infectious Diseases and the Public Health Institute and the Public Health Center, this is a kind of ancient regime, unfortunately, to protect their own very, very, the small size of the interest. And it's a bit difficult for us under the present, the legal framework to break through those of the existing, the process of the implementation. And then we now thinking to build up the new health crisis response organization. In order to do that, we are now thinking to merge the National Institute of Infectious Diseases and the National Center for Global Health and the Medicine. Most of those of the Center of the Disease Control has not the capacity of the clinical research, actually. And this is a very serious subject for most of the Center for Disease Control in many, many countries. Therefore, we are thinking to design, to create the new type of the Center for Diseases, which has the clinical research through their own the hospitals. This is the new challenge now we have. In order to do that, we have to create the act for it. And now I myself, as the chairperson of the subcommittee of the infectious diseases policy and governance, we are now preparing to propose the legal framework for the emergency at this moment. Maybe we can propose it to the next temporary, the term of the diet in this autumn or winter. Next, please. And next, please. And next, please. And then I would mention that the securing the dedicated hospitals and the required the sick beds for the emergency infectious diseases. The next, please. You can imagine when the Ebola crisis happened in the West Africa, we recognized that resilient health system is the most important the condition for the crisis management system against the risky infectious diseases. This is quite true. So fortunately, we have those very resilient health system under the universal health coverage. Therefore, we are now more efficiently allocate the new beds for the risky infectious diseases. Clarified at least 3 types: the critical, which should have the ventilator, and the hospitalization required is a middle level of the patients who required some oxygenation. And the other one is the very light and moderate or the asymptomatic. And those, the guys, they should be sent to not the hospital, but through the accommodations specifically for them to isolate them from the society against the infections. And now nearly we can prepare for the system for the medical suppliers side, and in order to avoid the corruption of the medical supplier side. So far, for example, in Tokyo, we have 21 serious and critical patients. But on the other hand, we have 100 the beds for the intensive care units, specifically for the risky infectious diseases. Maybe within the near future, we can increase it to 400. Therefore, still, even under the new wave is coming, we can still avoid the most serious, the peak of the spread of the infectious diseases at the moment. Next, please. Now, clarifying the division of roles between the state, the central government, and the regional governments. Next, please. This is the politics. The Minister Nishimura is now the most important speaker for our own risk communication. And on the other hand, the governor of Tokyo, Madam Koike, and the governor of Osaka, of the Hiromitsu Yoshimura, and those the governors became very famous because of some battles on the TV screens. And both sides emphasize that the other side is responsible to carry out some certain mission of the policy implementation. Why this sort of things happened at this moment? Next slide, please. We have an act of the special measures concerning countermeasure against the novel influenza. However, still we cannot clearly define the role of the central government and prefectures and the municipalities. We are now facing very serious subject that they make very clear the responsibility of the central government. And then under the leadership of the strong leadership of the central governments, we should rebuild our own system against those emergency, under which the central government should have more collaborative relationship with each prefectures and the municipalities and implement those policies from the top to the bottom. This is the serious challenge in the Japanese politics, but we have to do it within the near future. Next, please. The legislation for infectious disease emergencies. Next, please. We have several related acts for the new coronavirus. The Act on a Special Measure for the Pandemic Influenza, and Act of the Prevention of Infectious Diseases of the Medical Care, and the Community Health Act, the Quarantine Act, and the Act for the establishment of the Ministry of Health and Labor and Welfare. So we have to re-examine each part of the legal framework, and then we have to design the really right kind of the legal framework in which we can design the new, more efficient the process of the policy making and the implementation under the emergency. This is not the mid-term and long-term subject. This is the act under the emergency now at this moment. But under such a serious tension of the COVID-19, how to build up the real consensus among us and among the political parties in the Diet to adopt the legal framework is a real challenge for the Abe cabinet ourselves. Next, please. The creating a healthcare information system on an initiative and a basis. Next, please. Now, under the first experiences of this emergency against the risky infectious diseases, now we started to design and build up the individual health information system. For example, gathering medical information system on the COVID-19 and the health center real-time information sharing system of the COVID-19 and COVID-19 contact confirming, which can trace the infected person and clarifies who were nearly access to the infected person through the COVID-19 contact confirming application. At least more than 0.5% of our population should join this, but unfortunately still below 10 million people applied yet. So we have to increase it. But this is still a challenge of us. Next, please. This is really, honestly speaking, unfortunate, the fact of us. The left side, you look at that. Still, the information transmission by paper medium, mainly by the fax. And the process of ourselves take a long time to collect the right kind of information for the central government to manage the whole situation of the infection itself. Therefore, under the emergency, we are still now the battle to build up the new efficient, the information system for individual the health itself. But this is a very urgent matter. For example, even though that the central government, as I mentioned, started to design and implement those new system for the real-time transmission, but still Tokyo and Osaka has not joined it. Still those are the process of the coordination for the system design itself has a very serious conflicts between the central government and the local governments. In addition to that, we have a very, very serious the legal framework for the protection of the individual privacy and the individual rights. So the municipalities has their own the order to protect those the privacy when somebody try to use those the individual information such as the health information itself. They has a very serious the regulation of the prohibition to use those the information, health information itself. Therefore, we have to strengthen the authorities and the power of the central government to collect the right kind of the individual health information at the community level. So this is the one major challenge of us to revise our legal framework for the information system, specifically focusing on the health under the emergency. And next, please. And now, the two subjects for the global issues. I do realize that the World Health Organization should always keep the political neutralities among the conflicts of the member states. This is a very, very difficult job for the World Health Organization itself, specifically under the seriousness of the conflict is increasing among the member states itself. But how we can strengthen the basis of the Secretariat of the World Health Organization to protect itself, specifically for those the neutralities, is an urgent subject of us. But in order to do that, I really hope that the United States of America keep its own status as a member state. So it's a bit unfortunate thing that the US government decided to withdraw from the World Health Organization. I really hope that Japan and the US as a real alliance will jointly take initiative to reform World Health Organization itself and protect their own very important political neutrality as a normative institute in the global health. And next, please. And finally, I would like to mention that vaccine politics and the global health politics. Now, every leaders in every country now face very serious difficulties. If he or her delay to start the vaccination of the efficient and stable to their own people, if delayed, it is quite serious political difficulties they have to face. Therefore, now the many countries, developed nations and developing countries, both, and now try to get those the new and the safety, the coronavirus, the vaccine itself among those of the competitions and commit on those individual negotiations with the individual pharmaceutical corporation. But actually, the vaccine against those serious infectious diseases should not be only a business of the private sectors. We should recognize that the vaccine against the serious infectious diseases as a common, the interest, and we should recognize those the global public goods, the vaccine itself. But how to design those global governance which can fairly deliver the vaccines not only to the people in the developing countries, but also to the developed nation simultaneously. The vaccine become the real global issues. In the past, when we commit on the global health politics with our colleagues, like Steve Morrison, we mainly paid attention on those, the global health policy, focusing on the people in the developing countries. But now, simultaneously, we pay attention on the people in the developed nation as well for this, the new vaccination of the COVID-19. But we don't have such sort of a global structure for it. But we should have and avoid unnecessary, the vaccine politics in the future. And finally, I would like to mention that our people of Japan now recognize that the outbreak of the risk infectious diseases is a real serious threat, not only to our own health and our life, but also for our own ordinary social life and also economic life itself. And then, based on the recognition of the seriousness against those of the serious infectious diseases, we are now nearly build up the new consensus among our people, more prioritize infectious diseases as one of the top priority subject of our national policy making. And this is the part of our own national security as well. Maybe the new recognition of our own people may have a very positive political impact on our own Japanese politics, and we can speed up our process to catch up the digitalization and health system building, and also we can more efficiently join the global health politics, specifically fight against the risky infectious diseases. Thank you very much for your patience.
Well, thank you very much, Professor Takemi, for informative and comprehensive presentation, covering a wide range of issues from disease, the domestic politics, and international aspect of it. Those who live in the United States see a parallel as well as a contrast between Japan and the United States in terms of importance of national policy, national leadership, and also tension between administration and states. So there are lots to talk about. I'd like to invite Professor Michael Reich to present his commentary. Thank you. Could you unmute your microphone?
Hold on just one moment. Give me just a second. All right. Oh, there you're unmuted. Great.
Thank you. So I'd like to thank the Sasakawa Foundation for giving me this opportunity to provide a few comments on the excellent presentation from my good friend, Keizo Takemi. I've worked with him and collaborated now for nearly 4 decades. So I have a great appreciation for his contributions to global health. So I think we can sum up the presentation from Takemi-san through really one phrase, and that is governance matters. What I'd like to do, this is an important and I think underappreciated aspect of the pandemic. And so I'd like to compliment Takemi-san for his focus on this aspect. I'm going to look at this comparatively, in this case to look at governance in Japan and the US as it relates to the pandemic. As everyone on this call knows, the shape of the pandemic is dramatically different in our 2 countries. I prepared a few slides, but really these were slides intended to be as a background. So I'm going to give you one slide literally as my background, and we don't need to see the slides. This shows you the US and Japan. So it immediately raises the question, why are the paths so different in our 2 countries in thinking about total number of cases and thinking about fatality? And I'm going to focus on governance as the explanation, highlighting a number of the core themes provided by Takemi-san. First, I particularly liked his metaphor of the control tower for governance. So this is actually quite insightful and useful, especially when we don't have a good theory of governance. A lot of what we understand about the world is through our use of metaphors. So think about the control tower for an airport. Lots of airplanes in the air, on the ground, taking off, landing, driving around, but other factors as well. Birds, changing weather, security threats, and many other activities going on in the buildings. Someone has to give instructions to pilots so that people are safe, so that planes don't run into each other. Let's think about how this is done, who has to do what. Let's think about the control tower for the pandemic. First, note that a control tower exists in a particular culture, a set of shared beliefs and behaviors. Culture matters. For pandemic governance, one critical aspect we have found is the social culture of masks. Japan had an existing social acceptance of mask wearing in public, while the US did not. The US has been, to put it mildly, slow to accept the culture of masks, with differences across regions, with differences across political beliefs. There is increasing scientific agreement and recognition that the use of masks has a major impact on the shape of the pandemic and on transmission. This cultural context is important for pandemic governance. Governance exists in a cultural context and for the pandemic paths. A second related aspect for control tower governance are social values in the two countries. So do people listen to the instructions from the control tower? In Japan, people tend to listen to authority, okami ni shitagau. And they're sensitive to peer pressure, sometimes maybe too sensitive. While in the US, people have a strong tradition of rejecting authority, emphasizing personal liberty, the kind of cowboy mentality. Libertarian values are promoted even at personal harm to oneself and others. In the US, President Trump promoted these libertarian currents through his calls to, quote, liberate different states from rules announced by governors. It is no accident that he used that particular word, liberate. In effect, he was saying, live free or die, or maybe implicitly, live free and die. The third important aspect of control tower governance is the quality of national leadership. In Japan, the prime minister took responsibility for guiding the nation on critical issues and allocating scarce resources related to the pandemic. And Takemi-san showed us many different rules, laws, institutions introduced. In the US, the president's office effectively said, no control and no tower. It left the responsibility to the market and to the states to allocate resources. The result, Japan had a centralized and coordinated response, while the US saw a decentralized and fragmented response. Fourth is the use of scientific information and clarity of public communication by the authorities in the control tower. You need good and up-to-date information, adequate information to run an effective control tower, and you need clear instructions. In Japan, the prime minister mobilized and used scientific advisors, incorporating their ideas into public guidance. In US, the president mobilized and then sometimes rejected scientific advisors, criticizing and mocking them in public. These four striking differences in pandemic governance had marked effects on the effectiveness of technical strategies to shape the epidemic from the control tower. In Japan, testing and contact tracing was aggressively used through a centrally administered strategy of cluster finding, very effective in the first wave, perhaps not so effective in the next wave. In the US, the federal government had no articulated single strategy on testing and contact tracing, leaving states and local governments on their own with limited effectiveness of contact tracing and chaos in logistics and supply chains. Remarkably, these problems continue in the US still today. So finally, these different governance conditions occurred in countries with strikingly different social disparities and vulnerable populations. In Japan, there's more equal distribution of resources across social classes, reflected in health insurance for all since 1961. In the United States, by contrast, there are stark social disparities with vulnerable populations in food processing, prisons, nursing homes, densely populated poor communities, especially immigrant communities, many without health insurance, and those numbers rising, and they have borne the brunt of the burden. In conclusion, thank you, Professor Takemi, for reminding us of the control tower governance in our two countries and the importance of that metaphor and implementing it in policies and actions. You're also implicitly reminding us that the way to address the governance problems in the US for the pandemic is through the coming presidential election in November to change who sits in the control tower and get us back to rational public policy. Thank you.
Thank you very much. Before we turn to Q&A session, Professor Takemi, do you have any response to Professor Reich?
Oh, yes. The issue how to design and create those the control tower is clearly and closely related to the political leadership. Even though somebody has a wonderful political leadership, but who or her has not the function of the control tower subordinated by the bureaucracy, I don't think that the administration cannot efficiently cope with the increasing threat of the future infectious diseases. So the Michael quite kindly mentions that the Japanese people tend to obey those authorities, so that are easier for the central government to implement the policy itself under the emergency. But now it's not so simple. And at the first wave, as you mentioned, Michael, Japan can a bit efficiently contain the first wave of the infectious diseases through those cluster approaches. And when we publicized the state of emergency, we did realize that we have to protect our own individual rights and privacy and democracy and rule of law. And the legal framework of the emergency against the risky infectious diseases did not give the very strong authority for the strong central government to have the very strong law enforcement measures. Therefore, it's inevitable for our government to rely on the individual, the incentives to join the new initiative of the government against the COVID-19. The first wave, we could have those of the wonderful collaboration with our own people. But now we are facing the second wave, and gradually our people are a bit fed up and a bit tired. And it is a bit, the difficult phase we are facing under the next the waves, I think. So in the future, maybe we should have more strong authority of the central government to implement their own policy, especially against the COVID-19. Thank you.
Professor Michael Reich, very quickly, please, because we have some hands up. Thank you.
Just want to make one gentle disagreement with my good friend. I totally agree that Japan is now confronting a second wave which is a different kind of problem than the first phase. I would urge you to be cautious. It's not clear to me that more power in the central government, top down, is going to control this next community spread based phase of the epidemic. And using your own words, Keizo, about UHC, it needs to be a combination of top down and bottom up. If you cannot mobilize communities, community health centers, primary providers in the Japan Medical Association to help with a bottom-up strategy of control, we're going to see serious problems reemerging in Japan.
I can agree with you.
Thank you very much. Sorry, Professor Takemi.
Oh, that it is obvious that we have to create those well-balanced structure, both at the bottom up and the top down. But in this context now, we have to say that we have to strengthen the top-down decision-making structure, and in order to cope with more risky infectious diseases. And the second wave and third wave may create more difficult political circumstances for the cabinet. We can expect it.
Thank you very much. It sounds like it's a partially reflection of a different political culture and democracy structure. But I'd like to open up the floor for Q&A. Mr. Stephen Morrison, you got the first question.
Thank you very much, Keizo Takemi, and it's great to see Professor Michael Reich. A couple quick comments and a couple of questions. In terms of the clash with the United States, it's really difficult to underestimate, or it's very difficult to grasp, I think, the magnitude of the crisis that we face in the United States, the multiple catastrophes that are feeding on one another, when we've got 150,000 dead, 4.3 million cases, and a third of our country out of control in red states, and a large portion on the edge of being out of control. And this is leading to the collapse of public trust and confidence. It's driving our political process. And even if Biden is reelected, the magnitude of recovery and the length and depth of recovery is going to be enormous, and an enormous amount of soul searching on how this possibly happened. I agree with Professor Reich. This is a matter of a failure of White House leadership. It's a failure of our own toxic political culture and divisions, and a failure of the systemic weaknesses that we have in our public health system. On the international side, we've chosen to make our strategic confrontation with China the defining part of our international work. So we've chosen hyper-nationalism focused on China. The WHO relationship is a casualty of that. You mentioned COVAX. I'm very encouraged that Japan has stepped forward to support COVAX. I'd like to hear more from you on how big a contribution. COVAX needs, Gavi needs 18.1 billion in the next 2 years to play a meaningful role in addressing the requirements of low income and lower middle income countries when a vaccine or vaccines become available. It currently has less than 20% of that sum pledged. It's a very fragile initiative, and we really are at risk of as vaccines become available, of a very chaotic scramble that is only really benefits the wealthy countries that have locked up the supplies that are of those that are developing the candidates right now. So my question to you is, how big will Japan be in pledging towards COVAX and supporting Gavi in this next phase? Thank you.
Professor Takemi.
Thank you very much. Steve, thank you very much for the wonderful comments. And of course, that the magnitude of this COVID-19 is different. You have a very large size of the deaths, and we have the 1,000. However, I want to mention that the extent of the magnitude is sometimes different through the cultural aspect and the political experiences in the past. As I mentioned, since the 1961, when we achieved universal health coverage, we had not had such a serious the spread of the infectious diseases under the very peacetime. And since the Korean War happened in the 1950s, we did not have such sort of emergency, except the earthquakes of the Kansai and the Tohoku area. Therefore, this past experiences of the risky infectious diseases in the Japanese politics, even though our size of the magnitude is small, but have a very big political impact on the Japanese politics through the Japanese sensitivity. This is the fortunate things in the past, but those sensitivities of our people is not always the good things for the future. How to make our own individuals to be more tough and fight against those of the common enemy, such as the risky infectious diseases, and not always rely on the government. How to protect ourselves based on our own responsibility. The more toughness of the individual people is required for Japanese to create the new system itself. I hope you understand those differences of the history. And also the COVAX. This is the first challenge to create the global governance structure in which we allocate those limited resources of the vaccines to the people in a fair manner, not only for the developed nation, but people of the developing countries. This is a big challenge, but always each decision makers in each country try to widen their own alternatives to get the vaccine itself, not only through those bilateral negotiation with each pharmaceuticals, but also through the multilateral frameworks such as the COVAX, and widen the alternatives for those decision makers in each country to avoid those unnecessary political risks under the emergency. Therefore, I strongly recommend our government, and especially the Ministry of Health, to join as a friend of the COVAX. And we have already joined it as a friend. But by the end of August, we have to finally decide we are going to financing on the COVAX or not. This is a very serious, the realistic decision making will be taking place in the Japanese vaccine politics as well. But still there are so many uncertainties to what extent Japan will join the COVAX as a new global challenge as well.
May I just make one comment here? In the COVID supplemental bill that was just put forward by the Republicans in the Senate, that is now in deliberation in the Senate and ultimately will come back to the House, there is a provision in that for $4 billion put forward by the Republicans in the Senate, $3 billion of which would go to Gavi, and a $4 billion would go towards a UN agency for further distribution and dissemination and procurement of vaccines. So we have Republicans in the Senate coming forward in support of a $4 billion provision, not yet passed in agreement, that we haven't yet reached a point of consensus, obviously, between the House and Senate or between Democrats and Republicans. But this is a very important step if it can be carried forward. And it shows the power of parliaments, of legislatures, in responding to this critical need right now.
Thank you very much. Time is limited, but reflecting the importance of the discussion and subject matter, with the permission of participant, I'd like to extend the event by 10 minutes. And second question goes to Ambassador Milan Vervier. Ambassador Vervier.
Professor Takemi, thank you very much for your informative presentation, and indeed the contrast with the United States couldn't be more stark. You had mentioned international cooperation, and particularly with WHO. I remember reading that Prime Minister Abe, shortly after President Trump pulled the United States out of WHO, Prime Minister Abe said, this is not the time, whatever the shortcomings WHO may have, it is not the time to pull out, but to rally around WHO. And he said, in fact, it is the only global organization we have to deal with this current crisis. I wanted to ask you, as a global health expert, what detrimental impact the United States, which has a long history with WHO, as you know well, what detrimental impact our leaving WHO has had?
I can tell you that the China already under the leadership of the Secretary General Madame Chang, they efficiently increased their the commitment on the WHO itself through very, very able Chinese officers at the core part of the decision making. And then they quite efficiently, the China increased their own friends and partners within the member states of WHO. Very strategical manner, very efficient. But on the other hand, I really hope that China create the really efficient and fair and honest leadership within the decision making of the WHO without any individual interest. How to encourage, to create the real, the political, the neutral, the fair, the decision making within the WHO is a very serious challenge for the China itself. So Japan as a middle power, and also the friends of China, I really hope that the China will take the positive initiative as a major leading country in the WHO as a member state. This is the political position and my comment on yours. Thank you very much.
Thank you very much. Last question goes to Dr. Eric Feldman.
Yes, I hope, am I unmuted now?
Yes, you're great. Go ahead. Thank you.
I'm sorry, my picture says Stephanie Feldman. That's obviously somebody else in my family, but not me. First, I want to thank both Professor Reich and Professor Takemi. Incredibly interesting session. And I just wanted to solicit some more comments from Professor Takemi about the relationship between centralized and localized authority in the pandemic in Japan. I've been really interested in early on in the pandemic when the governor of Hokkaido declared an emergency. And then in the newspaper just today, I see that the governor of Tokyo is saying she may declare a state of emergency. And I guess I have two questions about that. First, I'm wondering whether either of the governors have the legal authority to be declaring states of emergency. It was my understanding that that was a prerogative of the prime minister, but not of the governors. And then I'm wondering whether in the sort of legal changes that you're suggesting, that I find just intriguing and puzzling, whether one of those legal changes ought to be that prefectural governors should have the authority to declare states of emergency that would give them particular legal powers, or whether you think that's a legal power that ought to be reserved for the central government rather than the prefectures.
Thank you very much. This is the real serious the question of us. But as I mentioned, that under the existing legal framework, the central government has not such a lot of the authorities to implement its own policy itself. And then we have to give more power and authority for the central government in order to correct the right kind of the information and data of the individual basis through the community level. Without the new strong authorities of the central government, we cannot build up efficient health system beyond those boundary of the prefectures. So we are not the federal, states like the United States of America, but under the recent administrative reform and the localization of our own, political entity itself, gradually the local government increase their own power and authorities to do that. But unfortunately, under the emergency of infectious diseases, we cannot, implement the policy making, which should be efficient against the fighting against the COVID-19. So one side, we have to strengthen our authority of the central government. On the other side, we have to make clear the role of the governor of the prefecture, and the governor has their own efficient authorities to implement that. Those are the balance of the structure. We should carefully take into account to design our own, the individual, the decision-making process for the emergency. So we are now challenged to design the new system itself, including the decision-making process itself.
Thank you very much. Professor Takemi, I know that as a politician, you've been having a super busy day every day, and it's already very late in Tokyo. So thank you very much for your generosity in sharing time and also sharing a view with American friends. And also like to thank Professor Michael Reich for presenting a comparative viewpoint in U.S. Japan context, and also stimulating discussion. I really appreciated your participation. And international problems obviously requires international solution. And the first thing first, that each country need to tackle issues domestically. But I hope that in the near future, U.S. and Japan can be jointly part of the solution to this international problem. And finally, best of luck to your battle against COVID-19 in Tokyo, and hope that, unfortunately, this is going to be a long battle, so hope that you will come back and talk to us again. So thank you very much, and good night. Thank you for everybody participation. Thank you.
Professor Reich, would you like to give one final comment?
So I would like to thank my friend, Professor Keizo Takemi, for all of his efforts, both in global health and within Japan. You are in a key position, both within the ruling party and within the government, and you have the ear of many of the decision makers in Japan. We have seen disturbing trends globally of moves towards increasing control by governments in authoritarian directions. Hungary, Poland, even in the United States. So I just hope that in your efforts to have more control over information, you also protect the democratic traditions that Japan has developed over the last decades. So we'll be looking, and we're supporting you to maintain the right balance in top-down and bottom-up. Ganbatte kudasai.
Thank you very much.
Thank you very much for meaningfully concluding the event. I really appreciate it. Thank you very much. Good night.
Night. Thank you very much.